In this video, we're going to talk about how to get started. The first thing that I want to make sure that you remember is that the goal is to get you to a place where you're both hormonally and nutritionally balanced. This is when you're going to feel your best. This is when we're going to be able to avoid and prevent a whole bunch of diseases and illnesses that are very common. Common doesn't make it normal, but that are common as we age, okay? So now we're all starting from a different place. Some of you are already eating very healthy, are already following a very healthy lifestyle, and you may just have to tweak a few things as we go along. And for some of you, a lot of the changes that I'm going to be talking about, you may feel a little bit overwhelmed. It may feel like it's a big shift from what you're currently doing. So everybody is going to take their journey a little bit differently. The goal is not to do everything 100% perfect. The goal is to improve what you're currently doing. Okay, so for example, if when we start talking about water, if I tell you you need to drink X number of water, everybody's a bit different. So we're going to get to that topic, and I'm going to tell you how to calculate how much water you should be drinking. If at the moment you're drinking no water at all, you may find it very overwhelming from one day to the other to go from 0 to the total amount that you should be having. So again, I don't want you to feel overwhelmed. I don't want you to strive for perfection. All I want you to do is to try to improve what you're currently doing. Now, if you have the personality of all or nothing, and some people do, they're like, okay, Dr. Miranda, don't baby me, just tell me what I need to do and I'm going to do it, then great. If that's your personality and if that's how you do the best, then do it. But if you're not, then your main goal should be to just improve what you're currently doing. Okay, so please remember that. The other goal is going to be to just increase awareness. And this will happen to you no matter what. I can promise you this. It happens to all my patients. At the end of a program like the one that we're going to be going through, you're going to find that you are a lot more aware of what's coming into your body. You're a lot more aware of what you're drinking, of your activity level. Maybe these are things that you never thought about before, and now you're going to be thinking about it and just becoming more aware of things. You're also going to do better by planning. So taking some time to maybe the night before, kind of like think about, okay, what's my day like going to be tomorrow, and then try to plan ahead. So taking a few minutes, and planning, can really make a big difference. The other thing that's going to happen is that you're going to start eating with purpose. It happens very commonly that we eat unconsciously. Like I've been with a friend and we've been together and we've been kind of like munching here and there throughout the day. And then my friend at the end of the day is like, oh my God, we haven't eaten anything. And it's like, yes, we did. We ate this, we ate that. And it happens, it's not just to my friend, but it happens to a lot of women that we just start putting things in our mouth or drinking things unconsciously. So going through a program like this is going to make you more aware, and you're going to start eating with purpose, okay? And all those are very important. I also want you to keep in mind what healthy aging should look like. I think as a society, we have a huge misconception that as we start aging, we are expected, to feel sick. We're expected to feel stiff and achy and feel tired and not sleep well at night. And there's nothing further from the truth. Okay. So just because we're getting older, we should still, if we're doing the right things and if we're keeping balanced, you should still feel a good amount of energy. You should still be able to have a healthy weight. I do want to say about the weight that as we reach perimenopause and menopause, our hormones start declining. So our body automatically will want to retain a little bit more fat because it's in fat tissue where hormones get stored. So it's normal to gain about 5 extra pounds during perimenopause and menopause. So for example, if you've always been, let's say, 160 pounds, this has always been your normal weight, during perimenopause and menopause, you can expect to maybe your normal weight to be like 165, more or less. Not the 10 pounds, not 20 pounds, certainly not 30 pounds that some women, gain, during these important years. So 5 pounds of extra weight gain, that's okay. That's expected. That's actually a good thing because we need a little bit more fat tissue for hormone storage, but not any more than that. Okay. Healthy aging also means a healthy sex drive. It means still a good amount of memory. So just because our hormones are declining, and the decline in hormones, that's what can lead to problems with our memory and cognition and focus. But we should still have not as many hormones as when we're menstruating, but we should still have in perimenopause and menopause enough hormones to still be able to keep a good, healthy memory. Okay, so we're going to talk more about that. Ideally, healthy aging means that you shouldn't need any medications. And again, when I say that, if you're currently taking a medication, I'm not suggesting for you to get off the medications without help. But as you start getting more balanced, the goal would be that with the help of your medical doctor, that you're able to wean off of medications because hopefully you don't need them anymore. Okay, and our mood should be happy. We should feel enthusiastic about life. Okay, we should be having good quality sleep. We want to feel energized in the morning. Again, just because we're getting older doesn't mean that we need to automatically wake up and feel like an 85-year-old lady, and stiff and achy in the morning. We want to have a good amount of motivation. We want to be active. We want to have good mobility and just feel steady in our feet. Okay. So yes, it is possible. And one of the things that we're going to see as we keep on going with the program and continue making the changes that I'm going to be asking you to make is that your body composition is going to start improving in the right way. So what do I mean by that? So if you look at the picture, there's the picture in the middle of a lady who needs to lose weight. She can lose weight the healthy way, which is the arrow going to the left, or she can lose weight the unhealthy way. So what does that mean? When we're losing weight the healthy way, we're actually losing fat tissue and maintaining muscle mass. Okay, losing weight the unhealthy way, this is when we lose muscle mass and we still keep, the fat tissue. So a lot of the programs out there that that are very popular, and you can follow and you lose like 10 pounds a week. There's some really drastic programs. You want to be careful with those programs because those are usually the type of weight loss that is very unhealthy because you tend to lose more muscle and not so much fat. Fat, we can't burn fat that quickly, and we burn muscle, we can, a lot quicker than fat. So you want to be careful with that. We want to make sure that as you're improving your body composition and as you're getting more balanced and feeling healthier, that you're keeping your muscle and that you're losing fat tissue. And when we're losing weight the healthy way, what's going to happen is that we're going to lose all sorts of inflammatory cytokines that will normally lead us to having a lot of cardiovascular health risks, such as high blood pressure, high cholesterol, predisposition for diabetes or an insulin resistance, and also cytokines that maintain us in a hormonal imbalanced state. Okay. So again, the goal is to lose and improve our body composition the healthy way so that we can lose all those bad and inflammatory cytokines and not the unhealthy way. Okay. Now, how do we know that we're doing things the right way? This is completely optional. One of the ways that we know is by just looking at how our clothes are fitting. Okay. So even if the number of the scale is not moving, your clothes should start fitting better. You can always even measure, make your have your own measurements done, like in the waist, measure your waistline, your hips, so that's one way of doing it. But another way, and maybe an easier way of following your body composition, is by getting a scale. Okay, so this is the scale that I recommend if you are going to get a scale, and this is completely optional. You don't need to do this part. Is this one, the Omron Full Body Sensor Body Composition Monitor and Scale. So it's available in many different websites. Amazon.ca has it. If you just type in the name, then it should give you the option. I think it's close to $100 or $110 or something like that. And it's some of you may have access to a scale like this at your local gym. So you certainly don't need to go and buy it, but if you think that you'd like to monitor your body composition, not only during the 6 weeks, but even ongoing later on, a lot of people are just like numbers people, and they just like to see things in the scale, how things are coming along. So this is an option. If you are going to get the scale, then for more accurate results, you want to make sure that you don't eat for 2 hours before your weigh-in. You want to make sure that you are hydrated before you weigh yourself. So you want to drink a glass of water before your weigh-in. You want to avoid any vigorous exercise for 2 hours before you weigh yourself. And you want to avoid alcohol for 2 hours before you weigh in. So the best way of checking your weight is maybe just when you first wake up, drink a glass of water, and then maybe in about 15 minutes, 20 minutes before you eat anything else, then, and of course without any clothes, then that's when you can check your body composition. One of the things that the scale is going to show you is what is your body mass index, so BMI. So most of you must have heard of the BMI. Ideally, an ideal BMI is anywhere between 18.5 and 25. If your BMI is between 25 and 30, then that means that you're overweight. If your BMI is over 30, then that means you're technically in the obese category. So if your BMI is currently over the 30, then your very first goal should be to, at the very least, get your BMI under 30, under the overweight, category. But if you're over, again, we're trying to improve what we're currently doing, right? So, but if you're currently at the overweight category, then your goal should be to get to the normal, category. Okay, so one step at a time. The scale will also give you the chart for what is an expected body fat percentage for your age and for whether you're female or male. So again, the scale will come with this information, but you can check to see exactly, where you're at when you first start, and then you can write down what your goal is. The next measurement that the scale gives you is your muscle percentage. Now, what's important to know is that this is not just muscle, but this is muscle and water. So muscle and water, there's no real way of measuring muscle alone and water separately. They're very much connected. And this is really important for you to keep in mind, because if you want to try to build muscle, like if you check your percentage and you compare it to the chart that you're given, and if you see that your muscle percentage is too low, then one of the ways in which you can increase muscle is, of course, you can just try to exercise more and do weights, right? But the other way is just by increasing your water. I have a lot of patients who are doing the hardest part, which is exercising. But if they're not drinking water, then they're not going to be successful at building that muscle mass. Okay. And then the opposite is true as well. I have patients who may not be ready to start a whole exercise regime yet. Maybe they still have a lot of aches and pains. Maybe they don't have time. Maybe they have children, or whatever the case may be. At the very least, if they start drinking water and keeping hydrated, the amount of water that they should be having for their body composition, then then they can start building the muscle, mass by doing that as well. Okay, so keep that in mind. Muscle and water comes hand in hand. The other measurement that the scale gives you is your visceral fat. So the visceral fat is the amount of fat in our middle region and also the amount of fat within our organs. So I'm sure you've heard people sometimes develop a fatty liver or fat around their organs, like their heart or their pancreas. And this is truly the fat that's even more dangerous. The one that's going to increase our risk for cardiovascular problems, even more so than the fat that's right under our skin, which is the fat that usually we want to get rid of because cosmetically we don't like to see it there. The visceral fat is way more important. So if your measurement is under 9, then your visceral fat is completely fine. That's exactly where you should be. If you're between 10 and 14, then that means your visceral fat is high. Anything over 15, it's very high. So this is a really nice measurement to keep track of as well. As you go on with the program, you want to see that visceral fat number decreasing if you are, if your level is too high. The next number that the scale gives you is your basal metabolic rate. So this is pretty much an indication of how many calories you should be eating in a day in order to maintain your weight. So for some of you, it may be 1,300. For some of you, it may be 1,600. You don't need to have this number for our program. So I just want to let you know that if you can't get the scale, if you don't want to get the scale, you don't have to, you don't need these numbers. But these are just, numbers that the scale gives you that can be helpful, if you wanted to monitor. Okay. So the BMR is, again, the number of calories that you can eat in a day in order to maintain your weight. If you wanted to lose weight, then you want to subtract from that number. And we never, ever, ever go under 1,000 calories a day because otherwise we're just starving ourselves and that's not healthy. And of course, if you want to gain weight, then you would increase, you would add to your current BMR number. Okay. And then the last but not least, and this is a measurement that everybody kind of like wants to know, what is your metabolic body age? Okay, so here you see in the picture, for example, you can have the same lady weighing 155 pounds, but the lady from the left is going to have a higher body age, and the lady from the left is going to have a younger, body age. So, for example, you may be 52 years old, but when you check the scale, your metabolic body age, if you don't have the right body composition, maybe at 65 or maybe at 75. And sometimes just knowing what your metabolic body age can be a bit of an eye opener. So as you start getting healthier, as you start getting more balanced, as you start improving your body composition, you should find that your metabolic body age starts getting younger. Okay. So before I end the session, I just want to say, again, that you don't need to get the scale. A lot of the gyms, a lot of the local gyms may have similar scales. It may not give you all of these different measurements that I've been talking to you about, but it may give you some. If you think that you're ready to start making long-term changes and you're wanting to monitor your body composition, not just during the next 6 weeks, but later on as well, then maybe you want to think about investing and getting the scale. I think it's a great idea. Okay, so otherwise, thank you so much for watching this video, and I'll see you in the next one. Thank you.